Come on, everybody, let's start. It's a very easy topic today. You all must be knowing this easily. Okay, we'll see that. First of all, the topic of discussion today is testis. Okay, testis are male reproductive glands. Okay, or primary, whatever, sex organs or whatever. So male reproductive glands, male reproductive system contains all the way from testis. What are the things which should be included in the male reproductive or genital, internal genital system of the males? First of all, the way from testis, and then followed by epididymis, and then followed by vas deferens. Okay, within the spermatic cord. Is it not? Spermatic cord is a mixture of some other things also. We'll see that later. Okay, spermatic cord. And the vas deferens is the component or content of the spermatic cord. Getting it or not? And then further followed by vas deferens will be joining with seminal vesicles. Okay, seminal vesicles. What is the use of seminal vesicle? What is it? Store the semen. Store the overall seminal vesicles. Seminal fluid will be secreted from the seminal vesicle. Okay. Nutrition for the spermatozoa will be produced by the seminal fluid, which will be secreted from seminal vesicles. We have seen already. Behind the bladder or behind the base of the bladder, urinary bladder, is the seminal vesicles. We have seen already, right? So medial to the seminal vesicles will be the end of the vas deferens. The vas deferens joins with the seminal vesicles and form ejaculatory duct. Okay, we'll see that later. Okay. So this is the male genital system. Internal. External genitalia includes penis and scrotum. Penis and scrotum includes the external genitalia. Okay. So let us see the basic things of the testis over here. So first of all, the testis is an oval-shaped gland, male sex gland over here. Oval-shaped gland over here because it will be secreting some hormones and everything. You know that very well, right? So the testis is inclined in such a way that the upper end of the testis will be inclined forward and lateral. Getting it or not? Testis will be inclined forward and lateral in this manner. Okay, it's not absolutely straight. Okay, so the testis contains upper end, lower end over here, just like the kidneys, and then two borders. One is the anterior border, one is the posterior border, which are convex in this manner. Anterior border and posterior border, which are convex in this manner. So what these surfaces might be? There is an anterior border over here, posterior border on the other side. What might be the surface which should form? Lateral and medial surface. For example, this is the border over here. This is the border over here. The surfaces are medial surface and lateral surface. Okay. Just think and imagine and tell me. Okay, don't mug up the surface. Okay. So yeah, medial surface and lateral surface over. Okay. The post anterior border is convex. What is that? Anterior border is convex and smooth. This is important. Okay. But the posterior border is flat. Getting it over? Posterior border is flat. Posterior border will be flat actually compared to the anterior border. Anterior border is absolutely convex, but the posterior border is a bit flat over. Okay. So this testis will be having a small body over here, sessile fibrofatty structure over here. Okay. Over the upper end of the testis. Okay. Which is a remnant of Mullerian duct. For now, just remember that. Mullerian duct's cephalic parts remnant will be in the form of the fibrofatty body over the upper end of the testis. You will be seeing in the viscera. Okay. And then this epididymis also contains a sessile or pedunculated. You know what is sessile and pedunculated? What is sessile and pedunculated? Botany will be there. It's a wrong back for me. A short video for me. Sessile? What? Okay, immobile. That means it's not like immobile or something. Pedunculated and sessile. Sessile means I think there is no stalk. And with pedunculated means there is a stalk. Okay, mobile or immobile, you can say that there is a function, but basically sessile means absence of the stalk. Okay, and pedunculated means with the stalk. Okay, so there is one more body called the there is one small body over here, over the head of the epididymis over here. That is called the appendix. What is that? This is called the appendix. Appendix means extra structure. Is it alright? Is it alright? Appendix. Appendix is the next piece. Appendix of testis. And appendix of epididymis. Okay. So this might be the remnant of. Okay, so mesonephric duct. What is it? Cephalic part of the mesonephric duct is the remnant of the appendix of epididymis. These are important, even though these are very much smaller structures and have no importance in case of gross, but for the viva these are important. What is it? Appendix of the testis is the remnant of Mullerian duct, cephalic part of the Mullerian duct, and appendix of epididymis is the remnant of mesonephric duct, from where the testis and the epididymis will be developed. You will understand that later. Okay. So towards the upper end, towards the head of the epididymis will be the two appendices over here. Get it or not? So if you see, this is the what is that? Sagittal section of the testis over here. Okay, sagittal section of the testis. This is the anterior aspect. This is the posterior aspect over here. Okay. So this is the upper end of the testis, lower end of the testis. Towards the upper end is overlapped by the head of the epididymis over here. The parts of the epididymis are head, body and tail. What is it? Head, body and tail are the parts of the epididymis over here. The head will be overlapping over the upper end of the testis, but the tail will be connected to the lower end of the testis by means of an areolar tissue and also by means of a remnant of the peritoneum, nothing but the tunica vaginalis we have to say. We know that already the testis is descended after the processus vaginalis. You know the process we have discussed already. Processus vaginalis during inguinal canal. Okay. So the remnant of the processus vaginalis is called tunica vaginalis. You know what is tunic means? Tunic means? Correct. Skirt, layer, no. Layer over here, but basically tunic means old, if you remember old Egyptians, the kings and everything will be wearing some sort of dress now, just like a small skirt and something will be there. Okay. So the dress is termed as tunic. Okay, that's why it is an outer covering for the human beings during Egyptians. All the kings will be wearing. But here, because these are the coverings over here, that's why it is called as tunica. Nothing but the covering in case of testis. Tunica vaginalis over here. Okay. So this part is the tunica vaginalis, which is a remnant of processus vaginalis, okay, which is nothing but the peritoneum in the fetal line. Okay. So the lower end, nothing but the tail of the epididymis is connected to the lower end of the testis by means of areolar tissue over here and also by means of this tunica vaginalis over here. Got it? So upper end is overlapping, lower end is connected over here. In the middle, the body of the epididymis, you should be lying over the posterior border, but towards the lateral aspect. If you see, this is the posterior border over here. Towards the posterior lateral aspect, this is the medial aspect. This is the lateral aspect over here for individual testis. So towards the medial aspect, there will be, for the posterior border, there will be vast difference over here. Towards the lateral aspect, there will be epididymis over here. Could you understand now? So epididymis, for example, this is the posterior, flat posterior border. Laterally, it will be occupied by means of epididymis, but medially, it will be occupied by means of vast difference over here in this manner. Get it or? So this coil tubular structure is nothing but the epididymis, nothing but the body of the epididymis. But towards the medial aspect, the epididymis continues as the vast difference over here. Get it or? So towards the posterior border, this will be the epididymis, and this will be the vast difference. Get it or? Okay. So this is the normal alignment of the structures over here. Now the coverings of the testis, we'll see that. First of all, the testis is covered by 3 layers. Okay. What is that? The outermost layer is nothing but the tunica vaginalis. This is the tunica vaginalis. Okay. Tunica vaginalis, which is nothing but the remnant of the processus vaginalis. How the process vaginalis will be formed? There is a structure called gubernaculum testis, which will be driving the peritoneum all the way from the abdominal cavity towards the scrotum. But later on, the proximal part will be disappearing or will be lost, but the distal part will be remained as a tunica vaginalis over here. So it will be like a sac. If you put a pocket in front of the testis, for example, this is the pocket over here. Deeper to that will be the testis over here. So this pocket over here is nothing but the tunica vaginalis over here. Get it or not? So this tunica vaginalis will be having 2 layers. So obviously, outer layer is nothing but the parietal layer, and the inner layer must be visceral layer, because it is closely associated with the testis, substance of the testis over here. So this is the visceral layer, and this is the parietal layer of the tunica vaginalis over here. Okay. So if any fluid fills in this, that is termed as hydrocele. Again, cele means sac. It's not cavity. Sac, you can see that. Okay. Hydro filled with water. Water, it might be the water. Hydrocele over here. So if any fluid fills up in this, generally the fluid will not be there in tunica vaginalis, but if any fluid fills up in this because of any pathological condition or congenital, so it is termed as hydrocele. If it is congenital, it is termed as congenital hydrocele. But in case of adults, it is termed as normal hydrocele. That's all. So what may be the examples of the hydrocele? How the hydrocele might occur? For example, in case of children, this part will be in communication with the abdominal cavity. That means the process vaginalis over here is not disappeared yet. Okay. So there will be a communication between the tunica vaginalis and the peritoneum of the abdominal cavity. So the abdominal peritoneal cavity will be having peritoneal fluid that will be accumulating within this tunica vaginalis. So this will be filled with the fluid over here. Okay. This is termed as the congenital hydrocele, because the communication is not yet lost between the abdominal cavity and this tunica vaginalis over here. Get it on it? So the peritoneal fluid will be accumulating within this tunica vaginalis and making it distended over here. Okay. So this is called the congenital hydrocele. What might be the causes for the adult hydrocele in after birth? What might be the reasons? Just think and tell me. What can cause the fluid accumulation? So in case of adults, this is lost over here. This is lost, and this everything is fused over here. This tunica vaginalis is fused over here. So now it is a closed cavity over here. So what might be the reasons? This will be filled with the fluid in case of adults. Just think of it. Infection. What infection might? Filariasis, absolutely. So outer there will be scrotal skin over here. So if the muscular bites over here, how the filarial worm will be traveling? Any parasite will be traveling in body through which route?
Lymphatic.
Somebody. What is that?
Lymphatic.
Lymphatics. Okay. Because everywhere blood vessels will not be present, right? So everywhere lymph will be present. Okay. So to the lymphatics, the parasites will be traveling from one area to the other area. Later on it may enter into the blood water gland, but basically it will pass through the lymphatics over here. So whenever it is passing through the lymphatics, it can easily reach the tunica vaginalis over here. So whenever the parasite occurs over here, obviously inflammation will occur. So that inflammation leads to edema, nothing but the collection of fluid within the tunica vaginalis over here, that is called the hydrocele in case of headaches. Or if there is any inflammation of the testis, if there is any infection to the testis, for example, person fell on some iron rod or whatever it might be, hitting the testis over here. So the testis will be having bleeding over here, is it not? So the bleeding anywhere in the body is a source for infection. Okay, for example, there is a collection of blood underneath the skin or anywhere in the body other than blood vessels. So that blood will be acting as a source of infection. So if there is a collection of blood within the testis over here because of the injury, so that acts as a source of infection. Get it or? So it's the food for the infection over here. So the infection will be occurring over here, over the blood and infecting the testis. That infection leads to inflammation of the testis. That inflammation leads to inflammation of the tunica vaginalis. Again the hydrocele will occur over here. Get it or not? Either outside source or inside source. Eventually, because of the inflammation, the tunica vaginalis will be getting the fluid over here. That's why it is termed as hydrocele. Get it or not? So this is the two layers of the tunica vaginalis over here. So it will be continuous above and below, and on either sides also the tunica vaginalis will be communicated over. I mean continuous with each other. Okay. This is a sagittal section and this is a cross section over here. Get it or not? Sagittal section and cross section. So this cross section, if you see, apart from the epididymis, the posterior aspect and the vas deferens, rest of the area of the testis is covered by this tunica vaginalis over here. Get it or not? So this part is a visceral layer over here, which is continuous at the lateral aspect of the testis with the parietal layer of the tunica vaginalis over here. Okay. But if you see properly, the epididymis is partly covered. To say easily, the posterior aspect of the testis is not covered by the tunica vaginalis, but the lateral aspects and medial aspect and the anterior aspect of the testis is covered by the tunica vaginalis. Getting it or not? Only the posterior aspect is not covered by the tunica vaginalis. Is it or not? So, in between the testis, see here, this is the visceral layer of the tunica vaginalis and the testis over here. In between the epididymis and this testis, this fold of tunica vaginalis over here, making a space over here. That is called sinus of testis or sinus of epididymis, you can say. Okay, what is it? There is a space, it will be in between the testis and the epididymis over here, which is termed as the sinus of the testis. Sinus means cavity or space. That means a space in between the testis and the epididymis is nothing but the sinus of the testis. So this sinus of the testis is situated towards lateral aspect over here. So if you are given a testis, to how to identify whether it is left side or right side, this sinus must be facing towards the lateral aspect. So if a testis is given, this must be facing lateral aspect. So obviously this testis must be, with respect to you, this testis must be left side obviously, because it is facing laterally. So if it is facing over here, then it becomes right testis over here. But here it is facing laterally over here, obviously it is the left testis. Okay, and the inclination of testis will be in this manner. So you will be getting the sinus of the testis over here, and the inclination will be in this manner. Getting it or not? So obliquely directed downwards and laterally. Okay, and then sinus of the testis must be towards the lateral aspect. So this makes you identify the right or left testis. Okay. So the next layer of testis which is covering is nothing but the fibrous layer, that is nothing but. So for example, this is tunica albuginea, it is made up of which structure histologically? Simple, no? So tunica vaginalis probably made up of which structure? Peritoneum. So obviously epithelium, squamous epithelium along with loose areolar connective tissue. Okay, and then followed by the fibrous tissue over here, just like a capsule around a gland, for example. Okay. So that is made up of moderately thick connective tissue over here. Capsule is made up of moderately thick connective tissue. So capsule will be carrying blood vessels, nerves and lymphatics. Would anyone understand? Any connective tissue will be carrying blood vessels, nerves and lymphatics, and other areas there will be adipose tissue also, normally connective tissue. Okay. So this green colored structure over here, which is next to the visceral layer of the tunica vaginalis, is nothing but the tunica albuginea. This tunica albuginea will be also be found in tunica vaginalis is also found in ovary. Exactly. Ovary is also covered by tunica albuginea. So here the second layer of the testis is a tunica albuginea over here, just like the ovarian tunica albuginea. Okay. And the deeper layer is nothing but tunica vasculosa. This is the tunica vasculosa over here. It is made up of areolar tissue. For example, if this is the testis, these are multiple lobules of the testis. I'll tell you how the lobules are formed later on. If you take one testis as a lobe, it is divided into multiple lobules over here in this manner. Each and every lobule contains seminiferous tubules. Okay, we have different generations of spermatogonia, and of course, while the spermatid cells, spermatozoa will be formed within these seminiferous tubules. Over or not, histological testis over or not? Over or not? Then tell me now, what are the generations all the way from base to till the lumen? Okay, certain cells on either sides for nutrition, that's okay. Spermatogonia, type A, type B. So which will be undergoing mitosis and everything? Okay, then further? Type A, type B, then further? What is okay. Primary spermatocytes and then followed by secondary spermatocytes and then followed by spermatids, then followed by spermatozoa. Okay, these generations will be asked in the exam. That's why I'm trying to remind you. Okay, right. So these generations will be found. So ovary is over or not? Ovary is over or not? Shall I ask you a question from ovary? No, huh? No, these are viva questions. That's why I'm asking. So primordial germ cell will be there, no? Primordial germ cell. The spermatogonia are formed within the testis over here. From where the primordial germ cell will be received by the ovary. It is not from the ovary. From where it will be received? Yolk sac. Primordial germ cell. There is a particular word, of course. You are partly right, but further you have to modify. So find it. Okay, that will be an important viva question. Okay, fine. So these lobules over here are lined internally by means of the tunica vasculosa. So this entire lobule is occupied by the tunica vasculosa, carrying the blood vessels over here, and also contains which cells over here around the seminiferous tubules. There will be sertoli cells will be deep within the seminiferous tubules, but there will be interstitial cells of Leydig. Sertoli cells will be on either sides of the spermatogonia, nourishing the spermatogonia over here. So those are within the seminiferous tubules, but outside the seminiferous tubules and within the walls of the lobule is the tissue, areolar connective tissue, that is nothing but the tunica vasculosa. The name itself says vasculosa. That means it will be carrying the blood vessels over here. Yeah, you know. So this will be like a loose areolar connective tissue within each and every lobule of the testis. So this is nothing but the tunica vasculosa, which will be carrying the blood vessels and also contains the cells, nothing but the interstitial cells of Leydig over here. Because it's a loose areolar connective tissue, it will be carrying the cells, nothing but the interstitial cells of Leydig, which produces mainly testosterone. Okay, fine. Okay. So these are the basic coverings of the testis. So what are the coverings from outside inwards? The visceral layer of the tunica vaginalis, and then followed by tunica albuginea, then followed by tunica vasculosa. These are the intrinsic coverings of the testis over here. What is the intrinsic and extrinsic? Intrinsic means what? Normally in case of intrinsic, in case of hand, what is intrinsic means? Within? Yeah, the start and end of the muscle is within the same region. So for example, you take opponent's policies and everything, they will be starting within the hand and they will be ending in the hand. But extrinsic means the flexor bones is longest, for example, it will be arising over here and it will be inserting over here. The same manner. So with respect to the testis, these are the layers which are surrounding only the testis over here, not any other structure. So these are the layers which are surrounding the testis. So that's what these are called the intrinsic. What might be the extrinsic? Absolutely. Far away from the testis will be the extrinsic coverings of the testis. What might be the layers? First of all, there will be scrotum. So what are the different layers of the scrotum? What we have discussed in the inguinal canal? First of all, the skin. Deep to that will be? Deep to that will be a muscle, nothing but dartos muscle. Further deeper will be? External spermatic fascia, which will be arising from? External oblique aponeuros, but from the superficial inguinal. And then followed by? Cremasteric muscle and fascia, because that cremasteric muscle will be also extending till the scrotum, right? And then followed by internal spermatic fascia, which should be derived from but deep inguinal fluid. Okay, so further followed by the parietal layer of the tunica vaginalis. These are the extrinsic coverings of the testis. What are those? Skin, dartos muscle, external spermatic fascia, cremasteric muscle and fascia, internal spermatic fascia, and further parietal layer of the tunica vaginalis. These are the extrinsic layers and these are the intrinsic coverings of the testis over here. In between these two coverings is the cavity of the tunica vaginalis over here. Got it or not?
So why parietal vein is considered as extrinsic?
Because it is far away from the testis now.
Sir, about the continuation.
Continuation is there, but if you take only this part of the testis, for example, that may be continuous. Even the scrotum is also continuous over here. Okay, skin is also part of the scrotum. Scrotum is continuous above, but it's also a separate entity over here with respect to the testis and away from the testis. Okay, because it is separated by the cavity, these becomes the extrinsic part or layers covering the testis, and these are the intrinsic part, which is immediately next to the testis. That is the only difference. Nothing other than that. Okay. So, see here properly over here, everybody. This testis is covered by the green color structure, nothing but the tunica albuginea. This tunica albuginea, towards the posterior border, it will be sending a septum into the testis over here in this manner. A septum over here in this manner from the posterior border. This tunica albuginea, same green color will be entering into the testis. Okay, and divides the testis into this cavity and this cavity. One is anterior, one is the posterior. Okay, so this septum or partition is termed as mediastinum testis over here. That is called mediastinum. Anywhere mediastinum? What's mediastinum? Of course, mediastinum thorax is a space between the two structures over here. The same manner, this is the mediastinum which is dividing these two cavities over here. Okay. So this is the mediastinum testis which is incomplete. It is not a complete sheath. It is an incomplete because it is perforated by these seminiferous tubules here and there. Getting it? It's like a sieve. You know the sieve? What is sieve means? Multiple perforations will be there to filter out the stones and everything they will use now from the floor and everything, right? So it is like a sieve, not a continuous sheath over here, because it is perforated by means of seminiferous tubules over here. Getting it or not? So this is the sheath which is separating these two cavities over here. And towards the anterior aspect, it will be sending multiple small projections over here, radiating fibrous structures over here, dividing the anterior cavity into multiple small lobules of the testis over here. Getting it or not? So it will be sending fibrous septae over here in this manner, radiating fibrous septae all the way from the anterior aspect of the mediastinum testis and divides the testis into multiple small lobules in this manner. Okay. Each and every lobule contains tunica vasculosa over here. Okay. So, and each and every lobule contains 1 or 1 to 3 seminiferous tubules. This numbering is important. What is it? The seminiferous tubules number in each and every lobule of the testis is from 1 to 3. This number will be asked in the examination. Okay. So these seminiferous tubules will be having coiled part towards the anterior aspect and a straight part towards the posterior aspect over here. So seminiferous tubules will be coiled anteriorly but straight posteriorly. So this is the mediastinum testis over here. So this coiled part will be within the lobule of the testis, which pierces the mediastinum testis and enters into the cavity which is on the posterior aspect over here. So whenever these tubules are entering over here, these tubules are termed as retate testis. What is it? Retate testis. Retate testis means network of tubules. All these tubules from each and every seminiferous tubule will be connected to each other over here. Okay, forming a network of tubules over here. That network of tubules is termed as retate testis. Getting it down? Retate testis means network of tubules, nothing but the straight parts of the seminiferous tubules over here. Getting it down? So what is the use of these straight tubules? What is the use of these straight tubules in histology? What is it? Careless bone? How people can? Of course, it's true. Any suction action will be there over here? So, you just go through the books. Okay, we'll see that. Okay, retate testis means all the straight tubules of the seminiferous tubules will be joined with each other, and these tubules will be carrying the spermatozoa towards the epididymis over here. Okay. So wherever multiple network of tubules are formed over here, this entire structure is termed as, network is termed as retate testis. Okay. So all these retate testis joined together and will be giving rise to afferent ductules. Is it or not? Afferent or efferent? Afferent ductules are different ductules. What is afferent means? What is efferent means? Efferent will be delivering the things. Afferent will be collecting the things. If you take the afferent arteriole in case of kidney, that will be collecting the blood from above downwards, okay, through the renal artery and everything, and then forming the glomerulus over here, and that will be delivering the filtered part of the blood over here again back to the body over here. So this is called the efferent, this is called the afferent over here. Okay. So here there is no afferents over here because it is not collecting anything from any other structures over here. But here it is delivering the things into other structure over here, which is called the epididymis. So these tubules over here are termed as efferent ductules. Okay. So the retate testis which is formed over here will be forming few tubules. Some 15 to 20 tubules will be formed, which are called the efferent ductules. Getting it out? It is delivering the spermatozoa from this oil part into the epididymis. It is delivering. Okay. Of course, it is partly collecting over here, but main purpose is to deliver into the epididymis over here. So that's why these are termed as the efferent ductules. Get it out? So this retate testis will be forming some 15 to 20 ductules, which are called efferent ductules. Those efferent ductules will be draining the spermatozoa into the epididymis over here. Get it out? So these efferent ductules are like conical structures over here. If you see from base to apex, it will be like a cone over here in this manner. Okay. So some 15 to 20. How many 15 to 20 efferent ductules will be present? This numbering is important. Number of seminiferous tubules are from 1 to 3. 1 or 2 or 3. And seminiferous tubules, nothing but the efferent ductules over here are nothing but the, how many? 15 to 20 in number. So these are like each and every efferent ductule is like a cone over here. Each and every cone will be forming lobule of the epididymis. So far we have seen the lobule of the testis over here. So each and every efferent ductule over here will be forming the lobule of the epididymis. Getting it on? So here the lobule is formed by the radiating fibers of the mediastinum testis over here. But here the lobule of the epididymis is formed by efferent ductules over here. Getting it on? So all these efferent ductules will be forming the head of the epididymis over here. Okay, each and every lobule is formed with efferent ductule. If you join all the efferent ductules, that will be forming the head of the epididymis over here. So head of the epididymis is made up of 15 to 20 efferent ductules, which are nothing but the lobules of the epididymis over here. Okay, so all these efferent ductules will be joined together and will be forming a single tubular structure over here, that is called the canal of epididymis. Getting it out? So whenever all the efferent ductules over here, which are nothing but the lobules of the epididymis, join together and forms a single tubular structure, that is termed as the canal of the epididymis over here. What is it? canal of the epididymis over here. This canal of the epididymis is very much coiled. If you elaborate it, it will come around some 20 feet or something like that. That much coiled it will be. Getting it or not? Some 20 feet, this canal of the epididymis will be in length. Okay. So this coiled tubular structure will be forming the body of the, epididymis over here. So head of the epididymis is formed by efferent ductules, but the body and tail of the epididymis is formed by canal of the epididymis over here. So the body and the tail of the epididymis is formed by the canal of the epididymis. And this tail continues as vas deferens, exactly. So the tail of the epididymis continues as the vas deferens, which is one of the component of the spermatic cord. So where must be the spermatic cord will be attached to the testis over here? So towards the posterolateral aspect is occupied by the epididymis. Is it or not? Posterolateral aspect of the posterior border of these testes is occupied by epididymis over here. And if you see, this part is the vas deferens over here. So where might be the spermatic cord attached to the testis over here? Posterior border towards the posterior median. So over here will be the attachment of the spermatic cord over here. So the spermatic cord will be attached over the posterior medial aspect of the posterior border of the testis over here. Getting it or not? So the spermatic cord will be attached over here to the upper end of the testis, but towards the posterior medial aspect over here. So what is the end of the upper aspect of the spermatic cord over here? The lower end is attached to the upper end of the testis towards the posterior medial aspect, but that will be extending till the deep ring of the testis over here. Getting it or not? So from the deep ring till the upper end of the testis towards the posterior medial aspect is the extent of the spermatic cord over here. So this spermatic cord contains not only the vas deferens but also contains which arteries and which veins? We have already discussed the varicose veins are formed by which veins? Which veins over here? Pampiniform plexus of veins which will be draining the testis into right testicular vein will be draining into right testicular vein will be draining into okay, we'll discuss that at the end of the class. At the end of the class we'll discuss. It's okay, fine. Let us see that. So now you understood where the spermatic cord is attached over here. Is it or not? Extending all the way from the deep ring till the upper end of the testis towards the posterior medial aspect of the posterior aspect of the testis over here. Okay, towards the posterior one. Okay.
Right testicular.
So this spermatic cord contains testicular artery which will be supplying the testis. Is it or not? So the spermatic cord contains not only the vas deferens over here but also the testicular artery, which is a branch of testicular artery is a branch of you already know very well. Abdomen aorta. Direct branch, that's what I'm asking. Yeah, that's true. That's what is the difference, no? So where the left testicular vein drains into and where the right testicular vein drains into? Left testicular vein will be draining into left renal vein. Right testicular vein will be draining into inferior renal vein. Okay, so where on which side the varicocele will be common? Obviously the left side. What might be the reasons for the varicocele? I have told you already two reasons. What are the two reasons? Which artery? That's true, which artery? Superior mesenteric artery, exactly. Yeah, in front of the aorta. And then any other reason? Renal cell carcinoma, how it will be obstructing it? Where it is draining into the inferior vena cava, on the way it will block the left testicular vein, obviously, and even the okay. So the spermatic cord also contains the veins which are called the pampiniform plexus of veins. That means multiple veins will be present within the spermatic cord over here. So why these multiple veins must be present in case of spermatic cord? Why not single vein?
So if it coils, then it will be
What will happen?
twist.
What will happen?
It moves around.
See here. The thing is over here is the testicular. The testis is supplied by what are the arteries over here? First of all, by means of testicular artery, which is a branch of, testicular artery is a branch of abdominal aorta, and then one more is the artery to vas deferens, which is a branch of artery to vas deferens. See, always remember, whatever the structures, whatever the arteries close to the particular structure will be supplying it. Can you get on it? So for example, artery of the vas. Vas deferens might be close to which arteries? Think from all the way from the testis towards the posterior aspect of the urinary bladder. All the way from the testis till the posterior aspect of the urinary bladder. No. I have given an order. Inferior vesical artery. Is it or not? The urinary bladder is very much close to the inferior vesical arteries, to which the vas deferens will be draining over here. Is it or not? So the artery to the vas deferens can extend all the way from the inferior vesical artery or from the superior vesical artery. Is it or not? Any other artery is there towards the testis? Towards the testis, any other artery is there? Think, right? Any other artery is there? Cremasteric artery is something. Cremasteric artery. Fine, still. Cremasteric artery also will be supplying the testis over here. But with respect to the vas deferens, the artery which is close to the vas deferens is either superior vesical artery or inferior vesical artery. Which are the branches of? Internal iliac artery. Which division? Anterior division. Very good. Okay. So artery to the vas deferens is the branch from, what is it? Either inferior vesical artery or superior vesical artery, which will be supplying the urinary bladder. Okay. This artery to the vas deferens also supplies the testis over here. Getting it on? And then the third artery will be cremasteric artery. Cremasteric artery is a branch of inferior epigastric artery. Is it not? Cremasteric muscle is present very much close to the inferior epigastric artery, right? If you take the inguinal canal, the deep ring and superficial inguinal ring, deep ring is very much close to the inferior epigastric artery. So inferior epigastric artery will be supplying the cremasteric muscle. Could you understand? Right? So the cremasteric artery, which is a branch of the inferior epigastric artery, which is a branch of external iliac artery. Absolutely, external iliac artery. Here artery to the vas deferens is from the internal iliac artery, but here cremasteric artery is a branch from external iliac artery through inferior epigastric artery. Getting it or not? So both the internal iliac artery and external iliac artery will be supplying the testis over here. Try to understand this properly. Okay. Arterial supplying venous drainage of the testis is a short notes and important wipe of questions also. Getting it or not? Right? See here everybody? So why these multiple veins are situated over here? Okay. So the testicular artery and the other arteries will be carrying the blood supply to the testis over here. So what is the basic reason? What is the basic reason why the testis is situated outside the body? Spermatozoa. Spermatozoa will form a bit lesser temperature compared to the body temperature. Okay. So if this is a testis over here, for example, so the arteries will be supplying the testis. These three arteries will be supplying the testis. Okay. So the same temperature, just like the body, will be maintained in these arteries. Is it or not? Is it or not? Whenever the body is supplied by these arteries, the same heat will be generated and sent to the testis also. But what should be happening over here? The temperature must be less compared to the body, like 1 to 2 degrees or 3 degrees temperature. Okay. So whenever it is coming over here, because of the plexus of veins, the blood will be very immediately, very quickly collected by these means of this pampiniform plexus of veins. That means network of veins over here. If it is 1 or 2 or 3 veins, the collection of the blood back to the body will be a bit slower over here. But because of the multiple veins over here, that will be collecting the blood very fast, so that the temperature will be minimized over here. Getting it or not? Getting it or not? For example, we have the renal artery and renal vein. Those are the individual veins beyond the branches over here. Is it or not? But here the veins are multiple compared to the arteries over here, to neutralize the heat over here, or to reduce the heat at the level of the testis over here. That is the use of these pampiniform plexus of veins. It's not the pampiniform plexus of arteries over here. It's a pampiniform plexus of veins over here. So compared to the 3 arteries, there will be multiple veins over here to reduce the heat over here. Get it or not? So that's why these pampiniform plexus of veins. What is that? Pampiniform. Pampiniform plexus of veins. Pampiniform plexus of veins. So these veins are present within the spermatic cord over here. But whenever there is an obstruction to the left testicular vein over here, so these veins will be getting the pooled up blood over here. So these veins will be dilated and will be overlapping over the testis, leading to the increase of the temperature of the testis. That further leads to infertility. Exactly. So the final outcome of the varicocele is nothing but the infertility if the patient couldn't get operated. Could you understand? Whenever the patient is identified to have the varicocele, few tests will be done over here, and immediately the patient should undergo a surgery. Okay, removing of the few ways of removal of the obstruction. That must be done. Okay. Then the venous drainage will be normal, so that the patient will not be landing up in infertility over here. So the final outcome of the infertility is, varicocele is infertility because of the excessive temperature over the testis. So this varicocele is an important short nose. Get it out? So the thing is, one more anatomical thing over here. These pampiniform plexus of veins, they will be forming around some, how many veins towards the superficial vein? So remember, this is important over here. So towards the superficial inguinal ring, these multiple plexus of veins will be joining together and will be forming 4 veins over here. Get it out? This is a superficial inguinal ring of the inguinal canal, and this is a deep ring, and further followed by beyond the deep ring, what is present? No. Are beyond the deep ring, right? Deep to the fascia transversalis, which structure is present? Peritoneum. Extraperitoneal fat over here. Extraperitoneal tissue will be present over here. Okay. So whenever the pampiniform plexus of veins are formed over here, all the plexus will be joined together and form finally 4 veins whenever it is reaching the superficial inguinal ring. Get it or not? Whenever these 4 veins join together, that will be forming 2 veins whenever it is reaching the deep inguinal ring over here. Getting it or not? This numbering is important. So multiple veins within the scrotal sac over here, but whenever it is reaching the superficial inguinal ring, all the plexus of veins will be joined together and form 4 veins over here. Those 4 veins will be joined with each other and forms 2 veins whenever it is reaching the deep inguinal ring. And beyond the deep inguinal ring, how many veins will be there? Only 1 vein will be present. Getting it or not? Only 1 vein will be present. That is called the testicular vein over here, or gonadal vein over here. So we have seen only 1 gonadal vein on either sides, right? So right gonadal vein beyond the deep ring, and left gonadal vein beyond the deep ring over here. So that right gonadal vein will be draining into inferior vena cava directly, but the left gonadal vein will be draining into left renal vein in a which manner? Right angle region. Okay. So this is the kidney, and this right angle inclination towards the left renal vein. So that's why varicocele is most common on left side rather than the right side. Right side also can occur, but most probably on the left side because of this perpendicular inclination over here. Get it down? So what will be the nerve supply? You already know that very well. Nerve supply will be any gland. Nerve supply will be femoral nerve. Genital branch of genital femur will be supplying. Genital branch of genital femur will be supplying. Cremastric muscle. Cremastric muscle. Okay. So testis will be supplied by again by means of sympathetic and parasympathetic nerves. Getting it out? All the way from above downwards, from the either side of the what's the spinal cord, there will be sympathetic and parasympathetic nerves. Those will be supplying the testis. You already know what is the use of the sympathetic and parasympathetic nerves. Sympathetic nerves will be parasympathetic nerves will be causing secretions, and sympathetic will be what is pain sensation. Okay. Coming to the pain sensation, the testis will be the pain of the testis will be radiated towards which segments? T10 and T11. Think over this problem. So if there is a pain sensation carried by the sympathetic nervous system, that will be reaching the T10 and T11 segments of the what is it? Dermatomes over here, segments of the spinal cord over here. So whenever there is an injury to the testis or any inflammation or infection of the testis, the pain will be radiated towards which aspect of the abdomen? Umbilical region and below the umbilicus over here. What is it? Hypogastric region over here. Okay. So for example, what is the sympathetic pain innervation? That means the pain sensation carried to the ureters. Which segments? Ureters and kidneys also? Yeah, below umbilicus. So what might be the segments? T11, T12, L1 and L2 also. Okay, see problem. So if there is the ureters are carried from T11 to L2 over here. You can see that it is T11 and T11 over here. Get it or not? So if there is a pain in the ureters because of the ureteric calculus or whatever it might be, the pain can be radiated towards the testis also. Could you understand? That is a referred pain. So here the segments over here, whatever it is carrying over here are similar over here. So if there is a pain in the ureter, that will be carried, the pain in the ureter will be carried towards the below the umbilicus level, T11, T12, L1 and L2. Okay. So that means towards the lower aspect of the, not lower aspect, towards the groin and towards the anterior aspect of the thigh also. But further it can be radiated towards the testis also. Getting it or not? So whenever there is an ureteric obstruction because of the pain in the ureters, that ureteric pain will be carried towards the testis also because of this same innervation over here. Could you understand? Could you understand about it, right? Testicular pain. So the testicular pain will be carried towards the segments, spinal segments, nothing but the T10 and T11 segments over here. Got it already, right? So if this tunica vaginalis is a bit bigger after birth, for example, the tunica vaginalis is bigger compared to the normal anal size. So what will happen? There is a term called you have to remember this term. What is it? Torsion of the testis. What is meant by torsion? Torsion is any idea? What? No. Torsion means what? Torsion means, yeah, almost all right. What is it? See here, for example, the torsion means, for example, if this is a tunica vaginalis, for example, this is a tunica vaginalis, okay? Both parietal and visceral layers over here. So a bit, this sac is a bit bigger. So that is around the testis over here. Getting it out? So this acts like a bigger bag over here. So the weight of the testis is increased now because of this excessive tissue. Getting it out? Excessive tunica vaginalis, their weight has been increased over. So what will happen? Because the testes are hanging within the scrotal sac, because of this bigger bag, it will twist around itself in this manner. So this is called the torsion of the testis. Getting it or not? So because of this excessive bigger bag over here, the weight of the testis is increased over here. Because the testes are hanging within the scrotal sac, so those are free. The testes are freely hanging within the scrotal sac. Because of this bag, excessive tissue over here, the weight is increased over here. So whenever it is, the person is moving here and there, the testis will be rotating around itself, around its own axis. Getting it or not? So this is called the torsion of the testis. So what will happen if this torsion of the testis occurs? The torsion of the testis occurs, what will happen? You can see the bag over here and the test is also over here. But this part is nothing but, for example, my hand is the superficial inguinal ring, for example. This is a spermatic cord. Now the crushed portion over here is a spermatic cord rather than the testis over here. Testis is rotating around itself in its own axis. Getting it out? Testis is rotating in its own axis, but the thing which is crushed over here is nothing but the spermatic cord. So whenever the spermatic cord is crushed, what might happen?
Blockage of fast difference.
Blockage of
Fast difference.
vas difference, it's okay. So even if the vas difference block is also maximum, what will happen? The spermatozoa will not be ejaculated outside. That is the only problem. And then other than that, what happens to the patient? Think about it. Blood vessels, exactly what will happen? Absolutely. The blood vessels will be crushed over here. Mainly the testicular artery will be crushed over here. What will happen if the testicular artery is crushed or the other arteries also got crushed over here?
Ischemia.
Obviously, ischemia to the testis. So the testis will be damaged over here. Testis will undergo necrosis. Getting it out? Okay. The patient will become again infertile over here. So torsion of the testis, what will happen? So obviously, whenever it is twisting around itself, so the blood circulation will be lost over here. So there will be ischemia, and what will happen further? If there is an ischemia, what will happen?
Necrosis of testis.
Of course, necrosis. There will be immense pain. Intense pain will be there because of the torsion of the testis. Because ischemia, that leads to the pain, so that will be related towards the umbilicus over here. Okay. So the torsion of the testis is an emergency. Otherwise, the patient will be losing his testis over here, ultimately resulting in infertility again. Getting it out? Varicocele is one cause of infertility, and torsion of the testis is another cause of infertility over here. Understanding the moment, right? Congenitally, you can say that, yeah, absolutely. Because if it is congenitally left more tissue, you absolutely can say that. Okay. But because of the excessive, this tissue will be leading to the torsion of the testis. That's true, you can say that. Okay. So hydrocele means what? What's that right? Hydrocele means collection of fluid within the between the parietal and basal layers of the tunica vaginalis, which might be the pathological or congenital. Congenital hydrocele because of connection between the peritoneum of the abdominal cavity with that of this tunica vaginalis over here. And acquired because of the infection or inflammation. Either injury to the testis that leads to hemorrhage that leads to infection, or filariasis over here. Okay, directly the muscle bites towards the scrotum that leads to pathological hydrocele over here. Getting it out, right? Let's see the testis.